Welcome to the Human Services Department's presentation on Turquoise Care, the New Mexico Medicaid Managed Care program. During our presentation today, we'll talk to you about the changes coming to the Medicaid program, some of the services offered by the four managed care organizations. We'll also talk about some changes coming to the Human Services Department. There will be an opportunity for you to submit questions via email, and we'll share that email address with you later on in the presentation. As we start all of our presentations with the Human Services Department, we start with the land acknowledgement. On behalf of the colleagues of the Human Services Department, we humbly acknowledge that we are on unceded ancestral lands of the original peoples of the Apache, Dene, and Pueblo past, present, and future. With gratitude, we pay our respects to the land, the people, and the communities that contribute to what today is known as the state of New Mexico. On this slide, you'll see the new mission, vision, and goals for the Healthcare Authority, which is the new agency that the Human Services Department will transition to on July 1st. We'll talk more about this slide in detail later in the presentation. So let's get started on the changes coming to the Medicaid program. First and foremost, the Medicaid Managed Care program name has changed. Many of you know this program as the Centennial Care Medicaid program. Well, on July 1st, we're going to be changing that to Turquoise Care. And the reason that change is happening is because the Human Services Department released a procurement to contract with the managed care organizations for another 4-year period. And on July 1st, the 4 managed care organizations that will be providing services to Medicaid members are Blue Cross Blue Shield of New Mexico, Molina Healthcare of New Mexico, Presbyterian Health Plan, and United Healthcare Community Plan of New Mexico. As of July 30th, Western Sky will no longer be providing coverage for Medicaid members. And the primary purpose of the presentation today is to make sure that all Medicaid members know that they are currently in an open enrollment period, which began on April 1st and will run through May 31st of this year. So please select one of these 4 MCOs. We also wanted to share some information with you all about managed care. There may be some individuals who listen to this presentation who may want to enroll in Medicaid, and these questions are some useful information for them. First of all, what is a managed care organization? Well, managed care organizations provide physical, behavioral health, and long-term care services to their members. Why does New Mexico Medicaid use a managed care model? Well, we utilize this model to improve health plan performance, healthcare quality, and outcomes for our members. And lastly, some people may be wondering what the relationship is between the managed care organizations and the Human Services Department. Well, the Human Services Department contracts with the managed care organizations, and the managed care organizations contract with all the providers and healthcare facilities throughout the state to provide the Medicaid members their services. We thought that we would start out the presentation by sharing which individuals are not required to select a managed care organization during open enrollment. First of all, Native Americans continue to have the opportunity to opt into managed care. They are not required to participate in the managed care model. However, if a Native American is in need of long-term care services, they will be required to select an MCO to take care of those needs. Secondly, for those populations, additional populations that are not required to select an MCO, they include individuals who are in an intermediate care facility for individuals with intellectual disabilities. Medicaid has a couple of categories of eligibility that are very limited, and those are in the following 2 bullets: the Qualified Medicare Beneficiary Program and the Low-Income Medicare Beneficiary Program. Specified low income are very specific programs that do not include the full Medicaid package and assist Medicaid members with their Medicare premiums. So they would not be required to select an MCO. Additionally, we have a very limited package for Medicaid family planning services, and anybody that qualifies for that category of eligibility will not be required to select an MCO. Neither will members who are currently enrolled in the program of all-inclusive care for the elderly, also known as PACE, and managed by the company called Innovash. And lastly, we have a program for emergency medical services for non-citizens. Those individuals will not be required to select an MCO either. So let's talk about how we got to the point of rolling out Turquoise Care. As I mentioned previously, the Human Services Department conducted a request for proposals in 2022, I believe. And by November of 2023, they signed contracts with the 4 successful offerers: Presbyterian, Molina, Blue Cross Blue Shield, and United. During the months of December and March, the state engaged in a very intensive readiness process with the 4 MCOs. That included desk audits, which involves reviewing policies and procedures of each of these MCOs, and also to do on-site visits at each of these managed care organizations to ensure that they are ready to serve members. And now during April and May, we are in the official open enrollment process, and you'll see more information about how members are being notified via yellow envelopes and postcard reminders later on in the presentation. In June, the MCOs will begin, they will receive their official membership file, and they will begin to send out Medicaid cards, member notices, and handbooks to their members. And on July 1st, they will begin providing services to Turquoise Care members. Here are the Turquoise Care goals and their vision that were utilized by the agency when the program was being created. Every New Mexico Medicaid member has high quality, well-integrated, person-centered care to achieve their personally defined health and wellness goals. And as you can see on this slide, there are 3 goals that the Medical Assistance Division utilized while creating the program and working with state partners to ensure that we are meeting the needs of all Medicaid members. So what's going to change under Turquoise Care? Some changes have already been implemented, like the first one, but I'm going to talk a little bit more about how we are continuing to support members under Medicaid. First of all, on January 1st of this year, the Human Services Department Medical Assistance Division received approval from our federal partners to allow for continuous eligibility coverage for children up to the age of 6. This is an excellent opportunity because so many families have to recertify for Medicaid, especially if they just have their children enrolled on the program every year. What this allowance results in is that family members don't have to recertify every year for their children who are enrolled in Medicaid. So it's an excellent opportunity for families to continue to receive Medicaid benefits. Secondly, we have expanded the access to supportive housing for members who may need that assistance. There will be the addition of chiropractic services for members, and we have increased the number of community benefit slots. And what that means is under the managed care long-term care program, for those individuals who wish to remain in the community, our federal partners allow the state to have a certain number of benefits. And as you might guess, there are many members that would love to remain in their community, and we have increased the number of those slots for members. And lastly, we are expanding the home visiting benefit for new mothers. This is support that's provided to new mothers after they go home and ensure that they have all of the wraparound services they may need. In the behavioral health arena, there is continuing work to expand services and provider and increased provider rates. And here are some of the behavioral health services where we are conducting those activities: dialectical behavior therapy, EMDR, both of which are great for processing trauma if members have experienced that, mobile crisis intervention services, CBT, cognitive behavioral therapy, and family functional therapy. So this is allowing the agency to increase provider rates, therefore resulting in increased number of providers for our Medicaid members. Okay, so let's talk a little bit about children in state custody. So when a child comes into state custody through the Children, Youth, and Families Department, they are automatically enrolled in Medicaid. And the department, the Human Services Department, released a requirement in the procurement to select one managed care organization to manage the care of all children in state custody. And that managed care organization is Presbyterian Healthcare. So they were selected as a single MCO for most children in state custody, and they will provide services designed to improve the health outcomes and experience of those children and their families and caregivers. There is a caveat to this requirement. Native American children who are in CYFD custody will continue to have their choice of any MCO or fee for service. Okay, let's talk about the open enrollment process. So, as you know, effective July 1, here are the 4 managed care organizations that will be providing services for Medicaid members. And as we've stated, the open enrollment period is April 1st through May 31st. Members must select an MCO to provide services. However, if you are currently enrolled with Blue Cross Blue Shield or Presbyterian Health Plan and do not want to change, you do not need to do anything, and you will remain their member. If, however, you are currently enrolled in Western Sky and you do not select an MCO, one will be selected for you. Regardless, MCO selection is for a 12-month period, and each year you will be given the opportunity to be able to change your managed care organization. Now, open enrollment for Native Americans who are eligible for Medicaid, as I've mentioned before, have the option to opt in to managed care. Native Americans are not required to enroll in a managed care organization unless they are eligible for long-term care services. One of the clarifications we'd like to make is that Native American members that are eligible for Medicaid can still access services through IHS, tribal health services, and urban Indian health programs. As we transition into Turquoise Care and the one managed care organization managing care for most of the children in state custody, we will be working with the managed care organizations such as Blue Cross Blue Shield and Western Sky to transition those children in state custody to Presbyterian. And if any of those children are Native American, they will have their choice to either remain in fee-for-service or transition to another MCO. Sometimes we get asked how the state monitors the managed care organizations. There are a variety of ways. First and foremost, there are several reporting requirements that are submitted by the managed care organizations to HSD, and they can include provider network adequacy report, service utilization reports, tracking of very specialized populations, such as long-term care members or members with high-risk pregnancies. So that is one way that we monitor their performance. Another way is that the staff at HSD also ensure that the MCOs are complying with all of the contract requirements. And later on in the presentation, you'll see where you can access both the MCO contracts and the managed care policy manual. And lastly, Medicaid provides the MCOs with quality metrics that they must meet. And so they will track those metrics either on a monthly, quarterly, or semi-annual basis. If you're a Medicaid member and need to select a managed care organization, here are a few questions that you may want to consider when making your decision. First and foremost, you should determine whether your doctor or local hospital is contracted with a managed care organization that you're interested in. And the way that you can do that is by contacting them directly or asking your physician's office if they are currently contracted with that MCO. Number two, all MCOs cover the same Medicaid medication formulary or prescription formulary. However, if you have a prescription that is not currently covered by Medicaid, you may want to have a discussion with the customer service relations people at that managed care organization to see what opportunities there are to help you with that prescription. And lastly, each of the managed care organizations offers what are called value-added services. These are unique to each managed care organization and are outside and above what is covered under the Medicaid program. So they can include things such as health and wellness programs, additional help for pregnant women, additional transportation offers above the Medicaid package. So you'll want to talk to the managed care organizations or go to their website to see what value-added services are most beneficial for you. And I'll share some of those later on in the presentation. Okay, so you're gonna receive a yellow envelope that I'll show you here in a minute, and it will provide you with a form that you can fill out. And these are the three ways that you can make an MCO selection. You can go to Yes New Mexico and log into your account and select an MCO by either following the banner at the top of that page that says Select MCO, or you can utilize the chat function, which is the little bubble that pops up on the screen, and you can chat and select your MCO. If you need assistance in terms of how to use that chat functionality, you can go to the HSD website, YouTube site, and receive step-by-step instructions on how to do that. Secondly, you could call the Human Services Department customer service line and select an MCO that way, or you can fill out the form that is being mailed to you by the Human Services Department. Again, if you are currently enrolled in Blue Cross Blue Shield or Presbyterian and do not want to make a change, you do not need to do any of these things. Here's what the yellow envelope looks like. It's slightly bigger than a typical letter size, but it generally has this information on it. And on the right side of the screen, we've taken an excerpt of the letter that's included in this envelope to show you what the selection box looks like. You will see that each family member, if you have multiple family members, must make a selection. And then you could mail that in, or you can do one of the options I just mentioned. If you would like to learn more about Turquoise Care, you can go to the Human Services Department website. You can get there by typing in NMHSD in your Google search bar, and it'll take you to the opening page of the Human Services Department. And at the top of that page, you'll see an option that says looking for assistance. That's the option you're going to want to hit. There's another one that's called looking for information. Do not hit that one. Click on the one that says looking for assistance. And then on the left side of the page, you will see health coverage, and you click on the down arrow and you will see Turquoise Care. This is where you will find a variety of helpful information regarding the managed care program. You'll see on this website page that there are frequently asked questions regarding Turquoise Care, and you just click on the little plus sign next to each question and the answer will pop up. We have the questions separated out by Medicaid members, Native American Medicaid members, providers, and children in state custody. So please take some time to go look at those questions and answers. We often get asked if the MCOs provide different services. And in general, they provide the same medical, behavioral health, and long-term services and supports for all members. However, as I mentioned before, each MCO will offer a unique package of value-added services that may differ. And as I mentioned, they are benefits that seek to improve the quality and health outcomes and or reduce costs by reducing the need for more expensive care. Okay, so we're going to meet your MCOs, and these are the 4 that we've mentioned, but I'm going to introduce them to you through their value-added services. So we'll go through a brief overview of some of the value-added benefits for each of these managed care organizations. Please go to their website to see the full detailed list, and you can make your selection from there. So let's start with Blue Cross Blue Shield. You'll see that they have a variety of value-added services ranging from after-school youth activities where they will pay for fees that might be required for, let's say, sporting events or sporting activities, I should say. They will also cover infant car seats. They have an infant diaper program that covers diapers for the first month of a newborn's life. They also offer Native American traditional healing, where they provide a certain dollar amount with care coordination to ensure that any Native Americans who would like to partake in traditional healing can utilize the funding for that. And then I'm going to show you on the next slide some additional benefits that they offer under their value-added package. Here you see that they also offer electroconvulsive therapy, lifestyle modification supports for nutrition and fitness. And keep in mind, with each of these value-added services, all of the MCOs may have either a prior authorization requirement or a requirement for care coordination or a limit, such as one per year. Okay, here are Molina's value-added benefits. You'll see that they'll allow up to $500 per year for new baby items such as a car seat, travel cribs, strollers. There's a fresh produce and healthy food at no cost. And there's also a prepaid debit card for additional benefits such as vision, dental, housing assistance, and transportation. Additionally, Molina has some apps that they are making available to their members as a value-added service, a behavioral health mobile app called Access to Be Me Health, and then Access to Molina Health Finder that will help members find resources in their communities. Presbyterian offers value-added services such as pregnancy passport and baby bonus baby program for new mothers and new babies, enhanced care coordination specialized services, Meals on Wheels for members returning home from inpatient admissions, coverage or payment for sports physicals, wellness classes. You'll see that there are some similarities across the MCOs, but the amounts of funding may vary from MCO to MCO. And lastly, United Healthcare. Their value-added services include transportation, additional transportation benefits above the Medicaid package, health-related social needs, medically tailored meals for members experiencing transitions of care, maternity support. You'll see that they have a list there of baby scripts, and WellHop, which is a virtual support group for members who are in the same stage of pregnancy, and they can discuss issues with people that are at their same level during their pregnancy. Social determinants of health includes a workforce fund for scholarships, funding to obtain certificates or degrees, and then a social determinants of health flex fund. Additionally, they offer children and adolescent value-added services, digital peer support for called MSR Youth, senior elder care health benefits, Pearls, which is a program to encourage active, rewarding life peer support, Senior One, assistance for members seeking care at a skilled nursing or home care facility, behavioral health value-added services, and SUD helpline that remains anonymous and confidential. And then lastly, traditional healing and alternative healing benefits. Okay, this is the portion of the presentation where we allow for questions and answers. However, because this is a recording, we will share with you an email address where you can submit any questions you may have after you have reviewed our frequently asked questions on our website. Okay, the last thing we'd like to talk about today during the presentation is the transition that's occurring with the Human Services Department. HSD is excited about the launch of the new Healthcare Authority Department. Beginning on July 1st, HSD will transition to the Healthcare Authority. And I'm going to share some more information about that. As I mentioned at the beginning of the presentation, this is the new mission, vision, and goals for the Healthcare Authority. The new mission is that we ensure New Mexicans attain their highest level of health by providing whole person, cost-effective, accessible, and high-quality healthcare and safety net services. The vision for Healthcare Authority is that every New Mexican has access to affordable healthcare coverage through a coordinated and seamless healthcare system. And lastly, the goals include leveraging purchasing power and partnership to create innovative policies and models of comprehensive healthcare coverage that improve the health and well-being of New Mexicans and the workforce. Build the best team in state government by supporting employees, continuous growth and wellness, and achieve health equity by addressing poverty, discrimination, lack of resources, and building a New Mexico where everyone thrives. And implementing innovative technology and data-driven decision-making to provide unparalleled, convenient access to services and information. Here's a brief timeline related to the Healthcare Authority creation. In the 2023 legislative session, the legislators passed Senate Bill 16, creating the Healthcare Authority, and in May, the governor signed that bill into law. In July and September, HSD partnered with Department of Health, General Services Department, and the Department of Finance and Administration to help create the budget for this upcoming fiscal year beginning on July 1. During the month of November, the law required that HSD submitted a transition plan to the Legislative Finance Committee and the Legislative Health and Human Services Committee, where Secretary Armijo presented this plan and answered questions. In December, as in the typical budget cycle, Secretary Armijo and Secretary Allen and others presented the Healthcare Authority budget request to all of the Finance Committees, Senate Finance, and House Appropriations. And in January and February, during the legislative session, they answered questions related to the transition to the Healthcare Authority. Beginning in March, the Human Services Department began communications out to customers and external stakeholders regarding this transition. And we are in the midst of making several changes and preparing for this operational change. So in June, we should finalize those operational changes, and the Healthcare Authority becomes effective on July 1. So this is what is going to be involved in terms of the changes that will impact the transition to the Healthcare Authority. It is going to be a building foundation for inclusive, affordable access to healthcare and whole health services with the goal of creating a healthier New Mexico. What this will allow the Healthcare Authority to do is to be able to purchase healthcare for a larger group of individuals. The transitions of divisions that will occur or that will take place as a result of the implementation of the Healthcare Authority is that the program divisions from HSD will all remain within the Healthcare Authority, the Income Support Division, Behavioral Health Services Division, Child Support, and the Medicaid program. Additionally, from the Department of Health, the Developmental Disability Supports Division and the Division of Health Improvement will transition to the Healthcare Authority on July 1. From the General Services Department, the State Employees Benefits Bureau that manages the healthcare for all state employees will transition to the Healthcare Authority, as well as the Healthcare Affordability Fund from the Office of the Superintendent of Insurance. So what is changing and what is staying the same? Some things will change on July 1st. HSD, DDSD, Employee Benefits Bureau, Healthcare Affordability Fund will all become the Healthcare Authority as one united organization. We will be better together. Email addresses, of course, will change. Administrative rules will have a name change to the Healthcare Authority, and all the operational items that you might imagine, such as bill signage, envelopes, letterhead, etc. Look out for our new name on public-facing outreach materials. What's staying the same? All the services that you receive from HSD, DDSD, employee benefits, and the Healthcare Affordability Fund will continue without interruption. So that would include Medicaid benefits, SNAP benefits, TANF and LIHEAP, and child support benefits will all remain the same. It will just be under a new name. You are still in charge of your care with this change, so please keep that in mind. Here's a great slide showing you how many lives will be impacted by this change to the Healthcare Authority. Currently, the Human Services Department serves nearly 50% of all New Mexicans in one form or another, such as SNAP, Medicaid, LIHEAP, all of the benefits that we currently offer. And that's 978,206 lives. With the Healthcare Authority, we will be transitioning 57,000 state employee healthcare benefits under the Healthcare Authority. So that's an additional group of New Mexicans whose healthcare coverage this department will manage. The Healthcare Authority will also collaborate with the public schools and the retiree healthcare plans to ensure that we are procuring the best healthcare benefits for all of these members. Here we have provided you all with links for Turquoise Care and the Healthcare Authority, and they are included in the presentation for you to check on, information related to Turquoise Care, the frequently asked questions we talked about. As I mentioned, here's a link for the Turquoise Care contracts. We are in the process of conducting roadshow events, sharing this information throughout the state. So you'll see a link to all of the events happening throughout the state. There's the managed care policy manual and the email box that I mentioned previously in the presentation. This is where you would submit any questions that you have regarding Turquoise Care if you could not find them in our frequently asked questions. And we will use those to update our frequently asked questions as well if we find that it is a commonly asked question. And then we do have on our website a summary of the MCO's value-added services, but please check the MCO's website for detailed information related to those services. And then we have our link to the Healthcare Authority, where we also have developed frequently asked questions regarding that transition. Please stay connected with our agency via Facebook, Twitter, Instagram. Here are some QR codes that you can take a snap of. This is where you will receive information about all of the changes that I've mentioned today and anything that may change, updates. So we highly encourage you all to stay connected with the Human Services Department via our social media sites. Thank you for being here today and listening to this presentation.